Hello everyone and welcome back to our channel. Today we'll be talking about a topic that affects millions of people every year, influenza. The most frequent outbreaks of influenza, an acute viral infection that mainly affects the respiratory system, happen in the winter. The influenza virus, or, in a milder form, the influenza B virus, is the culprit. The most common causes of pandemic and epidemic influenza infections are influenza viruses of type A, which also infect pigs, horses, birds, and humans. The hemagglutinin and neuraminidase proteins are the most significant in terms of viral virulence among the many proteins encoded by the influenza genome. Influenza A has 11 neuraminidase subtypes and 18 hemagglutinin subtypes. These two proteins make up the influenza virus envelope. The term antigenic drift refers to subtle variations brought on by point-to-point mutations in the hemagglutinin gene that help the virus partially evade immune system detection, whereas the term antigenic shift describes a sudden, significant, drastic, discontinuous change in the sequence of a viral surface protein brought on by genetic reassortment between the genomes of two or more influenza viruses infecting the same host. As a result, a new virus strain emerges that is genetically unrelated to the one that came before it. Antigenic shift happens every 10 to 20 years, whereas antigenic drift happens every 2 to 3 years. Antibodies created against the previous strain are rendered useless. The virus is transmitted via infected aerosols generated by sneezes and coughs. Hemagglutinin helps the virus attach itself to the target cells, that is, the respiratory epithelial cells. Neuraminidase facilitates the release of virus particles from the infected cells. These infectious daughter virions then spread to the adjacent cells, resulting in the spread of the disease to a larger number of epithelial cells. Infection is seasonal, and variation in hemagglutinin and neuraminidase leads to disease of varying severity each year. The incubation period is 1 to 3 days and directly depends on the inoculum size and the immune status of the host. The majority of individuals are asymptomatic or may develop minor upper respiratory tract symptoms like chills, headaches, and a dry cough, followed by high-grade fever, myalgia, and anorexia. Mostly, it is a self-limiting disease. Acute infection is diagnosed through viral culture, antigen detection, or RNA detection in nasopharyngeal swab samples. Real-time RT-PCR is currently the gold standard method for influenza diagnosis. Antiviral drugs are not recommended for routine seasonal or pre-exposure prophylaxis. It is recommended only for post-exposure and outbreak situations in hospitals. Eventually, resistance develops to these agents. General preventive measures like strict hand hygiene or work restrictions are recommended. The CDC recommends that people with influenza-like illnesses remain at home for at least 24 hours after they are free of fever without the use of fever-reducing medications. The major mechanism of prevention is seasonal vaccination of the elderly, pregnant women, children of age greater than or equal to 6 months, children of age less than or equal to 5 years, and individuals with chronic illnesses that place them at increased risk of complications of influenza, such as chronic cardiopulmonary diseases or immune compromise. The vaccine composition changes each year to reflect the predominant strains in circulation, but its efficacy is limited when a new pandemic strain emerges. The most common complication of influenza is secondary bacterial pneumonia. Ray's syndrome is another complication that occurs in children and adolescents. It is the fatty degeneration of the liver that causes acute encephalopathy. Thanks for watching. If you enjoyed this video, be sure to give it a thumbs up and subscribe to our channel for more informative videos like this. Also, I'd love to hear your suggestions on what topics you'd like me to cover in our future videos. Is there anything specific you're curious about or want to learn more about? Let me know in the comments section, and I'll do my best to make it happen.